The night sweats and the hot flushes are number 4, number 5. What's predominant is joint pain and sleep. Women still don't come in with joint pains. We ask them about it. They go see the orthopedic doctors about joint pains, or, they go and see the physician about joint pains. They don't come to see the gynecologist about joint pain.
Yeah.
And they come to see the gynecologist about the hot flushes and the night sweat.
Well, hello, everybody. My name is Theresa Loveland, and I am a co-founder along with Kelly Yamamoto, who's not here with us tonight. We are founders of Magnolia Wellness, and it is our great pleasure to be welcoming Dr. Premitha out of Malaysia, Kuala Lumpur. And she is a leading menopause specialist and the author of a recent study that surveyed over 1,800 working women across Malaysia about their menopause symptoms. She is a huge advocate for menopausal health. She's got extensive experience, 30 plus years as a gynecologist specializing in women's health. She also has led the development of Malaysia's clinical practice guidelines for menopause management, which is enormous. We need this so badly. And then she's also followed that up with education initiatives for healthcare professionals. She's also a board member of the International Menopause Society. And without further ado, thank you so much, Dr. Premitha, for joining us. We are so honored to have you.
It's great to be here, Theresa.
Yeah, thank you. So the study, which I have in front of me, is congratulations on the study, by the way. Can you tell us what really motivated you to explore these menopausal symptoms in Malaysia's working women?
Well, I think it was something that was long overdue, to be very honest.
Yes.
And I think as I sat in the clinic every day and I actually faced these women who were coming into the clinic with all sorts of multitudes of symptoms, and then I'm trying to dissect through all that and to think what's actually happening. What's the Malaysian scenario all about? Why is it that our women are actually not presenting with the typical symptoms that's there in the West?
Yes.
Why is that tiredness, the joint pains, the sleep issues? And I do believe that, with these symptoms, they were lost because they did not actually fall into that typical menopause symptom. So they did not know what was actually going on with them. And I thought that was really sad. And we really needed local data. And I do believe that we in Malaysia can study a huge group of women of different ethnic groups. And having that knowledge then would actually help us improve on menopause care in this country. So I think that sort of precipitated that whole move towards looking into what our women were facing. And I was really happy. I had a good team. We managed to collect data for about 1,820 women. We looked at women and of the Malay descent, Chinese descent, the Indian descent. We also had mixed ethnicities, just to give us an idea. Hey, this is what's happening here. This is what our Malaysian women are facing. And then looking at that, and then we are able to very confidently tell our women, hey, don't look out for the hot flushes so much. We are not presenting like that. So then we have more local data to emphasize that menopause here is very different.
Absolutely. Yeah, it's so important. And there has been some studies done about symptoms across some other ethnicities, but it's really been predominantly not women of Southeast Asian descent, even African Americans. So, and they really are unique and different to each cultural background or ethnicity. One of the things that I think that there's this sort of misconception that menopause or perimenopause is so much about hot flashes. And really, so many women don't experience that. That's not their experience. And having this work that you've done and really bringing forward this information is so important. so that women can really identify what they're going through. One of the things that really surprised me was that joint pain and sleep disturbances were coming up more than the hot flashes. So what do you think? Why do you think that this is more dominant in women in this region than, say, other ethnicities?
Well, again, this is totally a postulation. But if you look at our data and you look at Singaporean data, they're almost the same.
Yeah.
The night sweats and the hot flushes are number 4, number 5. What's predominant is joint pain and sleep.
Mm-hmm.
So that sort of corroborates our own data that, yeah, you know what, in this part of the world, it is actually very different. Why joint pains? I really can't say, but to be very honest, women still don't come in with joint pains. We ask them about it. They
Yeah.
go see the orthopedic doctors about joint pains, or, they go and see the physician about joint pains. They don't come to see the gynecologist about
Yeah.
joint pain.
Yeah. And I,
They come to see the gynecologist about the hot flushes and the night sweat.
mhm.
But by then, they've already seen many other doctors about many other symptoms. Now, sleep, again, is something that, we are getting more and more. But to be very honest, I actually feel that it is also our tolerance towards the heat in this part of the world. And many
Interesting.
women may already be flushing, but they don't recognize it. They don't see it as a major problem because anyway, we are in a hot country, or we are always in the aircon. We sleep with the aircon. We have aircons in the offices. So they don't appreciate that temperature change so much, or they brush it off to the fact that, it's a hot day anyway. So
Mm-hmm.
I think our tolerance is better. So
Yeah.
we are actually flushing, but we don't complain about it until
Mm-hmm.
it gets to that extreme point.
Mm-hmm. That's really, really fascinating.
Yeah.
Yeah. Very,
So,
very
but we
fascinating.
are having joint pains, and that is what we call the non-specific joint pains. A lot of it is inflammatory.
Mm-hmm.
We have a lot of inflammation that comes in with the menopause that's causing the joint pains, a lot of sleep issues, also because we tend to overthink a lot of things. We need to go and practice good sleep hygiene before when we are in this menopause transition. And of course, when you are not sleeping, which can
Mm-hmm.
also be because you're having sweats at night, but if you're not sleeping, then you're going to get moody the next day. You're going to
Mm-hmm.
have brain fog, and you're going to have a lot of other symptoms like irritability, unable to concentrate at work,
Yeah.
tiredness, which is just going to cascade down.
Absolutely. One of the things that you mentioned just a moment ago was talking about how women, they're sort of isolating their joint pain and maybe they're going to an orthopedist. And I think it is really something important to shed some more light on the fact that you're trying so hard to educate all clinicians, so that all physicians, so that when these women do go to an orthopedic doctor and they complain about joint pain, that doctor has the knowledge and the education to go, this is not, this is related to menopause or perimenopause. And the same for the cardiologist, and the same for all of these different specialties. I think it's so important. I personally wish that I had that same experience where I went to a cardiologist and I had a full workup because my primary care physician thought that my palpitations needed full workup from a cardiologist. And the cardiologist, if he would have known and had your influence, would, I think, have been able to help me better understand what was going on with me. So big kudos to you.
Thank you. We've got a long way to go. We are just, starting this whole process. We have a lot of things to do. Yes.
Yeah, I agree. There's no shortage of work to be had. Another thing that your study found was that Indian women had the highest symptom burden and almost 3 times higher chance of experiencing multiple symptoms. What are some, why? What are some possible reasons for that?
Again, I think here, especially, culture plays a huge role. Again, I'm postulating, some of it is from studies that we have done before on different aspects of health in the multi-ethnic population. But I think we need to understand culture in Malaysia to answer that question.
Yeah.
So we have the native Malays who are Muslims, and they tend to accept symptoms as they get older. So a lot of their religion is based on the fact that accept and move on, which is great, which is beautiful.
Mm-hmm.
And so they tend to internalize and they accept the fact that they're having some mood changes or sleep issues. And to them, it is, let's work around it, let's with it and see how it goes until
Mm-hmm.
it gets to that extreme point. Now, with the Chinese, they've always been gung ho about health, and that's actually proven to their benefit. So, whenever you have a free blood test, they're there, which is great because then they look after their health. Or if
Mm-hmm.
you have an exercise program in the neighborhood, they're there. Line dancing, Tai Chi, they're there. And that works to their favor because that exercise is a lifestyle change that would help them. So that's great. Then you have the Indian women who actually put themselves last.
Yeah.
Culture is the fact that the family comes first, the
Mm-hmm.
husbands come first, the children come first. They are last in that process. On top of it, there have been studies that have shown that Indian women have got more inflammation. Inflammatory processes may be more. And that again makes their symptom burden worse. The third thing is that there are more cardiometabolic changes in the Indian women compared to the Chinese and the Malays. But
Mm-hmm.
to say that, the world is getting more Western. So yes, the Malays and Chinese are coming up, but the Indian women have got more of the diabetes, the insulin
Mm-hmm.
resistance already inherent in them. So
Mm-hmm.
when they're going through the menopause change, it comes up. And so because of that, their symptoms get worse. The joint pains, the weight gain, the menopause belly, all doesn't help with the fact that they don't sleep well, they have more pains, their
Mm-hmm.
moods change, and again, inflammation comes in. So I think that's what it is. And it took me by surprise. To be very honest, I
Mm-hmm.
did not, even think that that would be the case. I mean, I knew that a lot of Indian women were suffering, but I did not realize the numbers were so high until the results actually came out. But it's
Wow.
good that we know so that now we can actually pay a little bit more attention. And in any case, every woman, we shouldn't be looking at the fact that, oh, because you're Chinese, you may have less symptoms. We need to individualize every woman. That's so, so important. We just cannot. So this study is great, but what our take home from this is the fact that we need to look at every woman differently,
Mm-hmm.
understand what is the background, their culture, how
Yes.
they envisage themselves going through menopause, and then help them through that.
And I think that this study really helps show how unique these cultures are and just brings to light that you really need to have a nuanced conversation with every woman that's going through these.
And accept what they would like. We have to
Yes.
work with them, with their culture background,
Yeah.
because at the end of the day, it's not only her, it's her in that family, which is really
Yeah.
important.
Let's say you have somebody, an Indian woman that's in your clinic and you're speaking with her. How do you go about having this conversation, knowing what you found from this study, and knowing about their culture? How do you go about having that conversation, and what does maybe a care plan look like for her?
Well, I think again, not only that Indian woman, it can be that Malay woman, it can be that Chinese woman. And again, I emphasize individualized treatment because
Hmm.
just because you're Indian, I don't spend 3 times more attention to you because that
Yeah.
shouldn't be how it is.
Right.
But I think it is more the fact that what are you going through? How do you feel about it? What are your thoughts going through? What are their problems in the sense of how comfortable are they in their body at that point?
Hmm.
Looking at what we can do with lifestyle to
Yeah.
try and tweak that, cutting down the coffee by early afternoon, trying to relax and unwind by evening, sometimes changing the time of exercises to morning rather than evening, which might stimulate you.
Right.
Simple things. Talk to them about going for a traditional massage relax you?
Mhm.
Cutting down the alcohol, stopping the smoking. What can you do to make yourself sleep better? And it might be even odd things like, if your husband snores, maybe you need to find a place where, you are going to have a better sleep so that your sleep becomes more important at this point.
Yeah.
So yeah, bringing fun into that conversation, I think, is also very, very important because we need to lighten the load
Yeah,
and also
absolutely.
know what she is going through in terms of family pressure, children leaving home, or children not being very well, family members not being very well, financial, what's
Mhm.
workplace like. And I think all these life stresses
Mhm.
play a role in how that woman is going through that menopausal transition. We also ask a lot of questions about their periods before
Mhm.
and how they went through their pregnancies. And this is really very important
Mhm.
because of the fact that if they have had bad PMS or premenstrual symptoms, which
Yeah.
can also lead to, a lot of moodiness, depression, bloating, these are the women that are probably going to go through that transition a little bit worse off.
Mhm.
If
Yeah.
women have got postnatal depression or pregnancy depression, they are
Mhm.
then going to go through this transition with a lot more symptoms. So picking up from
Mhm.
their history before is very important. Have they had depression or anxiety issues? They're going to go through menopause very, very differently. If they've
Mhm.
had pregnancy diabetes, high blood pressure, then these are things that can come up again during the menopausal transition. So getting that proper history
Mhm.
is so important because then you can sort of target these areas and say, hey, look, because of all these things, these are your weak points at this particular point. Let's work on it and see what we can do. And then we go from there. And I think, it's just not about coming in and, let's have a chat and, check you up and go. It's not. It's that conversation about their life and
Yes.
about their periods, their reproductive health, which
Mhm.
carry such a big weight at the time of their transition. That's the most important way we can individualize her treatment.
And I think by doing that, the way in which you're doing that, it really empowers them and they feel where they're in a position where it's appropriate for them personally. And that gives them the agency to maybe make the changes that they need to, those little tweaks that you were referring to about maybe shift your exercise to the morning. And so I love the way in
Moving
which
out of the bedroom and moving out of the bedroom if your husband
yes,
snores.
exactly. Yeah, precisely. Or some nice earplugs. So, another really fascinating insight about the study, and I would love to know how you arrived to bringing this into the study, is one of the things you found was women with higher income actually reported more symptoms. And I think that kind of goes against what many people would assume. So, I think twofold kind of two questions within one. How did you decide to add this income piece into it? What did you think was going to come from it? And then why do we think that the result, like, why did this all happen?
Well, I think that was maybe a bit cheeky of me to actually bring that in because I was actually seeing all these women who are managers and senior women at the peak of their careers, CEOs and women of authority coming in with problems. And I was just thinking, and that sort of made me think a little bit more about, is it more in this group of women? And I did my reading and I found that in many parts of the world, it was actually the other way around, that it was a lower socioeconomic group that had more symptoms, while the higher socioeconomic group knew about menopause. They dealt with it a little bit better with lifestyle changes and awareness, and they did not complain about it so much. But at the same time, it got me thinking, is it because the fact that the lower economic group did not have that pathway to see the doctors, while the higher socioeconomic group actually had more leeway to see the doctor? So that's why they were actually better. They maybe went in yearly for their conversations and they actually already prepared themselves for that part of their
Mm.
lives. Not sure, don't know. But it was
Yeah.
very interesting to see, even in my own practice. And now that I'm talking to my friends, and
Mhm.
they themselves, my colleagues who are themselves telling me that it is the higher socioeconomic group that's actually coming in. And I think that's also because the higher socioeconomic group have got a lot more pressure. They are really at that point where they are facing facing what I would call, we are that sandwich generation. So we are
Yes.
working, we have to present ourselves well. We are
Right.
trying to go up in our careers. We are facing male dominated society,
Yes.
and we have to prove our worth. At the same time, our hormones are changing. Menopause is not something that you can talk so much at the workplace.
Yeah.
And so, because of that, they cannot openly talk about what they are feeling. They are also probably looking after aged parents, a lot of
Mhm.
things that are going on, trying to juggle career, family, everything together, and maybe having a lot of changes that they're not able to cope with, and now coming seeking help because they are now more aware that menopause can cause all these problems. And I think that knowledge is bringing them in. And
Mhm.
that's really good because I think, that awareness is telling me that the awareness is coming up out there in women, and they are willing to actually come in and seek help.
Yes. Yeah.
But
Yeah.
at the
So
same time, I feel actually very sorry for the lower socioeconomic group. Again,
absolutely.
basically because maybe they are not seeking help because they don't know.
Yeah. They
And
don't
if
know,
you
or
look,
maybe they don't have
they
the
don't know.
access. Yeah.
And so, if you look at the cultural aspects again, because the Malays sort of internalize and accept changes, so they may not be so forthcoming with their symptoms as such.
Yeah. And also maybe they don't have access in the same way. Yeah. And maybe even the knowledge as well.
So
Yeah.
again, I'm extrapolating lower socioeconomic group, maybe belonging to the smaller towns.
Mhm.
And in the smaller towns, access to healthcare, as you said, knowledge amongst doctors about menopause health may not also be there. So
Right.
because of that, they are probably that group that is being left out in many ways.
So, many women, they might feel isolated or confused about what is going on with their bodies. And this study really shows just how common these experiences really are. What's one thing that you hope women will feel when they see your findings?
I think to be able to connect with whatever the findings have actually shown, and to know that they are not alone, which is, I think, very, very important.
Absolutely.
Menopause is going to happen to every one of us who live to that certain age. It's going to happen to all of us. And I also want women not to fear menopause. And I think that's also very, very important. It's not something that you need to dread. It's
Yeah.
not something that, you start unnecessarily stressing yourself about. Oh my God, I'm going to go into menopause and I'm going to look old and decrepit and all my organs are going to fail me. That's not what menopause is all about, you know and I don't want women to get scared about it, but I think more the fact that, look, menopause is going to happen. Let's handle it. Let's see what we can do to make it better. Not everyone is going to have those symptoms, but yes, if we do have the symptoms, these are the common symptoms in Malaysia. Come, let us help you through it. Let's
Hmm.
work around it. It does not necessarily mean that you need hormone replacement therapy. A lot of things can be just dealt with just lifestyle changes, taking the correct supplements,
Hmm.
having a good talk with your doctor or a good friend or a counselor, just getting you to sort of rewire your brain chemistry a little bit, tweak your body a little bit. And in many instances, that's just enough to make her feel better.
Yes.
She
Yeah.
just needs a shoulder to cry on. She just needs someone to listen to her, to understand what she's going on, and make her understand that these are what the changes that you can accept, that you expect, and what you
Yes.
can do about it, increasing that awareness
Yes.
and letting her talk it through with you. And that's what we actually need to tell them. And, I'm hoping that with this study that they are now aware that this is what it's like in our own country. and
Mm-hmm.
that the symptom burden is actually quite high. These are the symptoms, but we can help you out.
Yeah. I think that I was having this conversation a couple days ago about women are, we are very, very intelligent. And when you provide us with the knowledge that we need to understand what's going on with our bodies, it's very empowering. It's also extremely validating when you, especially when you feel like you're alone and you're going through this on your own. And equipping them with this knowledge, they're going to be able to make decisions and choices for themselves that are going to serve them the best. And so really getting that education and knowledge out to them, it's enormous. It does wonders.
I think so, because they just need to be told that, you know what,
Yeah.
this is what it's all about. You, whatever advice that we give you, take it home, see what works for you. It might work for me, it might not work for you, but at least you are open to the fact that you need to work to see what would be better for you. And that's really very important.
Yeah,
And not
so important.
every woman is the same. Everyone's different. Everyone needs different kind of exercises. Everyone eats differently.
Yeah.
Everyone's sleep zone is very different. Everyone's partner is different. So all that actually matters in, and you've got to put all that together to make yourself better.
Mhm. Yeah, I'm hearing that this experience is so unique that it's like our fingerprint. And that's both fascinating and also kind of scary at the same time because there is no one size fits all. So what your
Absolutely.
best friend is doing is not going to be what's potentially the right thing for you. So really being open to, you know, hearing about the knowledge and how you can empower yourself to make those specific changes for you.
Absolutely.
One of the other things, there's such a stigma with aging, and I did a search a couple years ago on Google, and you type in menopause and images, and what pops up is this old looking woman, like really
Quickly,
old,
wrinkly.
wrinkly, you know, solid hair, a solid head of gray hair. And I'm sitting there looking at this and I'm like, that is not me. I am in this stage, and that is totally not me. And I think and women I feel associate menopause with aging. And then aging has this like really negative connotation, especially in a lot of westernized countries, I feel. And so I think we need to change the narrative on
Absolutely.
aging itself. And then also there's so much education that has to happen that, women can experience perimenopause symptoms in their late 30s even. So yeah, I just feel like there's this really necessary issue where we need to change the narrative on this.
Yeah. And I think it's really important to normalize menopause.
Yes. Yeah.
It should be a conversation that should not be carried out in whispers behind closed doors.
Yes.
It should be out there. It's like, talking about financial and you should be shouting the fact that I'm having a hot flush, but I'm okay. I can do the job for today. I mean, that's how it's supposed to be. We all have days that we can't sleep, however healthy we are, but we still function the next day. So normalizing menopause is very important. And what's great, if you normalize it, you work on it and make yourself better, that's the way to go. And if we women can actually show women out there that's the direction that one needs to take, then that whole narrative of that aging, crinkly, white hat, stoopy
Yeah.
woman would then change into probably a woman like you and I in the next 20 years, which I think is really important for women to see that kind of image at that endpoint.
Yes. Yeah. 100%. So, you talked a little bit about the workplace and, like, hey, if we don't sleep well the night before and we still have to go to work and we still have to function. And women are really experiencing this transitional time of their life where they might be in the peak of their career, and trying to navigate this huge transition during that time. There's still such a stigma that exists, especially in the workplace. And what do you think employees need to understand? What do we need to change in the workplace? How do we go about doing that?
Well, that's a long road because of the fact that when you look at the workplace, we have different types of workplaces.
Yeah.
So we have smaller workplaces, which may not be so receptive to having that conversation of menopause, there. But you have the bigger multinational workplaces now that are actually bringing up the conversation of menopause because half their crowd or half or even more than half of their staff may be women. And a lot of these women are women in that transition zone above 40. And these
Yeah.
are productive women who are doing so many things and making it worth in their own company. So I think that conversation is increasing in these multinational companies, but that's not enough. So
Mm-hmm.
again, conversations are important. Not downgrading a woman who is going through that transition is very
Mm-hmm.
important. Not selling her short for her promotions because she's taken some time off to actually deal with her menopausal symptoms, coming back to work and being productive. That's great. In fact, we should be applauding her for dealing with it rather than hiding away her problems.
Yeah.
We accept cancer. Somebody has cancer, they go for chemotherapy. Everyone's supportive.
Yeah.
Everyone, and chemotherapy can knock out your ovaries and you go into menopause, but no one cares. And they
Yes.
support you during that time and you come back and you're well. But if you have a well woman who is now going through menopausal symptoms, she may be looked at very differently from by people around her. You can get the younger women around her or maybe the young ones in their 20s and 30s who may not know about menopause so much.
Right.
And now she is feeling like she's not being able to lead them or they are looking at her very differently. So all this actually plays a role. So that conversation, again, making it a normal conversation, having more chats about menopause, having that team effort to make that woman feel better, getting her to look after herself more, maybe having lifestyle changes in the office, work from home policies, letting her have her little fan at her desk, laughing through the hot flushes. Ah, yeah, I'm having a hot flush, but it's okay. I've got my fan with me. Turning that moment from a serious moment into a moment that you can handle and move on.
Yeah.
That again, going back to normalizing menopause, so
Mhm.
very important. Like how we normalize pregnancy,
Right.
normalize menopause. Why is it that menopause has got such a bad stigma? Again, as you correctly said, it's all about the fact that that woman feels that she is aging and she may not be as productive as before. So giving her that confidence to move on and that the fact that she can probably do even better once
Mm-hmm.
she goes through that change and all is not lost. Very, very important.
Yeah. Yeah, I 100% agree. One of the things that, one of my favorite things to do actually is to give talks about perimenopause and menopause. And I feel like is a great place for these talks because you're teaching when I'm doing this, I'm really teaching them about what the experience is like and giving a little bit of, reasoning behind it and getting people to really understand. And I think when we do that, we are normalizing something that is very, very normal. Uh, the other
And I
thing
like the
too.
males to come in. I
Oh,
actually
I
like
was
the
I
males
was
to come
just
in.
gonna say that. Yes, I was just gonna
Yeah,
say the last talk
because
that
they
I.
need to know. They
Yes,
need to know
yeah,
what's happening to their women colleagues. They need to know what's happening to their wives, to their sisters, to everyone
yeah,
around them. So I always encourage the males coming in. And I know that for many of my talks, the males actually go back with so much more knowledge, which would make them empathize with all the women around them.
yeah. The last talk that I gave, there were 4 males in the room. And they had the most questions compared to the
Wonderful.
females. It was really fascinating actually to see. I loved it. I absolutely loved it. And the other thing about males is they have this broader view because they're not the woman. Well, the woman is, they're going through this transition. It might be something where they're developing symptoms slowly over time and they're justifying and continuing to justify and they're just dealing with it. Men, they're watching all of this happen And I've had clients tell me that their husband is the one that pointed out, hey, I really think that you need to get some support because I feel like there's some things that have changed with you enough to the point where you need to have some help. And so having the male involved is enormous. We all need to know about this change that you brought that up.
That's so important. Really,
Yeah.
really important. And
Yes.
I have had even sons pointing their mothers through pushing their mothers through my door because they feel that the mothers are very different. And it's great to see that, the male community is now getting on board about it. Still, again, a long way to go, but we're getting there slowly but surely.
Yes. Yeah. We're all sort of collectively working together to make these changes. One last question. You were talking about you were needing to write up the second half of this study. Any little nibbles about what that might be about, or are you going to keep us in suspense?
For about 6 months, probably. But basically, we took a lot of data. We actually collected a huge amount of data. But this part had to come out first because we needed to talk about the symptoms first.
Sure.
The second part is actually about how these symptoms are affecting women at work and what they are doing about it. We also had questions about who they are comfortable to talk to. Are they
Mm,
comfortable to talk to their male colleagues, female colleagues, bosses? So we have all those data.
amazing.
We
Yeah.
also have data about what policies they have at work.
Mm-hmm.
Do they know? There were even questions about, do you have policies? Do you know? And many of them actually said they don't know anything about any policies at work. So
Wow.
this is data that we have collected. So I will say keep in view for the next 1 year because we have two more papers to come out from here. Yeah. So, but it is interesting to see that I will give you some glimpses about it that up to about 40% are actually having these symptoms at work,
Mm-hmm.
which
Wow.
is universal. I think the numbers are the same everywhere in the world. And it was great to see that our numbers are also there.
Okay.
Around 10% actually find it really bad that they are thinking of quitting work or they have taken time off work. But of course, because this is a questionnaire, I have to have some disclaimers here that, we can't get actual data from here, but this is just to give a glimpse of what potentially could be the problems that they are experiencing at work. A lot of data, a lot more to come out. So,
Mm-hmm.
yeah, maybe we'll have this chat again in about 6 months and then we can talk about part two.
Yes. Yeah, I'm really looking forward to that. I can't wait. Bringing light to that sort of data is going to really help workplaces shift how they support women. And so I am thrilled that you collected that data because it really shines a light on the gaps in how we support women. And yeah, just we've got to do better. So thank you
Yeah. So
so.
I'm trying to bring out the health economics after that because, if I can bring out that
Yes.
data about the percentage of women who actually leave work or take time off
Mhm.
work, maybe I can work with a health economic person who can then
Yeah.
calculate the loss of income,
Yes.
economic loss for the country, which I think from the government aspect, it would be a very important
It will matter.
fact for them
Yeah.
and to
In the
help support
US,
these women.
yeah. In the US, it's $180 billion annually lost. Is there anything else that you'd like to share or last minute thing that you'd like to say before we close this out?
Well, I think, again, I always talk about the fact that don't dread menopause. And I think that's really an important take home message. Menopause, not to be feared about. We go into it with eyes wide open, which is the most important fact. Not everybody has all the symptoms that we talk about. Many women just breeze through it. But what we are trying to do is that for that woman going through that transition, we want to talk to her about keeping herself healthy for the next 30, 40 years of our lives because of the fact that we know that women live longer than men, one to
Yes.
7 years more than men, but we do not live healthier than the men.
Right.
So
Right.
our extended years of life are not healthy years. And that's that shift that we need. We want to make women healthier as we get older. So that's that main take home message. That's why all these conversations about menopause, we want all women to be healthy, to do what they want, and to be productive until that time comes.
Right. Right. Amazing. Thank you so much, Dr. Premitha, for joining us. It
Thank
was such an
you.
honor
Thank
to
you
have
so much for
you.
having me.
Wonderful, eye-opening conversation, and really just reminding us that every journey is so deserving of being heard. They're deserving of being seen and supported. Every journey is unique to them. Just to the women and men that are out there that are watching or listening to this, women, you're not alone. Men, please be aware and get the knowledge so that you can really help support and just be there for them. I think that's about it for us. Thank you so much again, Dr. Premitha, for joining us. And I cannot wait in 6 months for that next round of information to come out. So thank you very much.